in the Matsu Valley, because you all have such great relationships with one another and really give the example of what a partnership really is. And from last year's partnership meeting, it was just so wonderful to hear how much you all support each other in the borough. And I think statewide, we can really learn from that and taking care of our children, youth, and families here in our neighborhoods, making sure that we all have successful starts. So there's wonderful advocates in the room, lots of great people that we've had long-term relationships with. So to start us off, we're going to go ahead and around the room and introduce ourselves. And then we, folks online, thank you for joining us statewide. Please introduce yourself in the chat as well. So my name is Rhiannon Hodem-Keha. I'm the partnerships lead here at the Alaska Pediatric Partnership, and I'll go ahead and kick it off to Tamar.
Thanks, Rhiannon. Hi, everyone. I'm Tamar Ben-Yosef. I'm the Executive Director for the Alaska Pediatric Partnership.
Hi, my name is Carmen Wenger. I'm the Director of Programs for the Alaska Pediatric Partnership.
Hi, I'm Kathleen Marshall. I am a pediatric neurologist and I subspecialize in neurodevelopmental medicine at Ptarmigan Connections.
Hi, I'm a physical therapist. I'm Chelsea and I work at Playful Learning Pediatric Therapy.
I'm Mac Adkins. I also work at Playful Learning and then the CFO.
Hi, everyone. I'm Cheryl Saturnino, Program Officer at Rasmussen Foundation.
I'm Lindsay Hammer. I'm also Program Officer at Rasmussen Foundation.
Hi, I'm Esther Pitts. I am the Chief Community Impact Officer for Matsu Health Foundation and also sit on the A2P2 board.
I'm Dr. Bruce Hess, a pediatrician at Ptarmigan Pediatrics and work at Matsu Regional. And I'm also on the A2P2 board.
I'm Taylor Waldner. I'm the Marketing Director for Alaska Behavioral Health.
Hello, everyone. Mark Lackey, Executive Director at CCS Early Learning.
Hello, I'm Darylyn Byram. I'm a center coordinator at the Palmer CCS Center.
I'm Tyler Bowman. I'm the Projects and Partnerships Coordinator at Connect Matsu, which is a program of the Matsu Health Foundation.
I'm Kelly Newman. I am the outreach director with Links Resource Center and also do employee engagement there.
I'm Mary Beck. I'm a parent advocate at Links Resource.
I'm Katie Towns. I'm the Program Director for the Community Parent Resource Center of Lakes Resource Center.
I'm Susan Mansfield. I'm Susan and I am CEO of Guidepost Pediatrics.
I'm Jane McFarland. I am an early learning specialist for the Department of Education and Early Development. I work specifically with preschool programs in school districts.
Janelle Lawson Johnson. I'm also a program officer with Rasmussen Foundation. We had a nice field trip.
I'm Sue Brosnahan. I'm a key account liaison with the vaccine division of GSK.
Hello, everyone. My name is Amy Gorn. I'm also a program officer, but with Matsu Health Foundation. My name is Sonia Sipos. I am the program manager for Health Alaska, which is a program with the Alaska.
And I am Donna Reisinger. I'm the communications and training coordinator for the Alaska Pediatric Partnership.
And we have a whole bunch of people who signed in online. There are 34 participants online, and I'm Lord. We've got someone, and we've got a pediatrician in Nome, and we've got someone from Seattle Children's Hospital, hi Erin, and really all over the state. So thank you everyone for joining us. It's great to have everyone here.
We turn over to Dr. Hesper. Welcome.
Well, welcome everybody for coming out. Dialed up some really good weather for a day to come talk about pediatric resources in the valley. So we're real happy that you guys are here. So it's a nice day to have a meeting like this and enjoy meeting each of you guys. It's technically a co-sponsorship. We would have this over at the hospital, but they're upgrading to Cerna, their whole hospital wide. So every conference room they have in place is dedicated to changing their EMR over, which as a physician we're excited about that. But by next year we'll be back over there, or we might continue here. Just they were the ones that provided the food, so we really appreciate that. But anyway, welcome. Look forward to hearing what everybody has to say about the programs that they do.
Thank you. All right, well, it's my turn to do some announcements, so sorry. linkages to behavioral health care for children, youth and families. So A2P2 has been doing some contract work supporting the Division of Behavioral Health and Agnew-Beck on a rapid access for care landscape analysis project. And essentially, the division is looking to increase linkages between providers to behavioral health for children and youth, and to understand the landscape of the services that exist, how providers are accessing care, how they're looking at the different ways that different practices maintain lists or use outside resources like Help Me Grow, or really to get an understanding of a better understanding of the landscape in Alaska. And so we've been providing some support on that. There is a survey that we are asking providers to answer in the next few days, ideally. Looks like it's it opens today, and it's open through May. It's that long. We have several different surveys. So there's one for school counselors, school nurses. So if you're with a school district and you want to fill out a survey, we can get you the link to that one as well. This one is for individuals working in a medical setting. But please, if you wouldn't mind taking some time at some point in your week to respond to that, that will be helpful. Thanks. Our next partnership, our actual April partnership meeting is in Fairbanks on April 4th, and pairing it with Go Blue Day. So we're going to be wearing blue. And we're also looking at potentially hosting a family event in Fairbanks on Thursday for like a books, blocks and balls developmental screening, developmental health event, activities for kids, and ways for families to engage with their kids in a developmentally appropriate way and have fun. So we've done these events in different places around the state, and they're really, really fun. So if you happen to be in Fairbanks and want to partner with us on the event, or want to come to the event, you're welcome to. If you want to travel to Fairbanks for the event or for the partners meeting, obviously you're welcome to, and the meeting will be streamed online. And last but not least, my due diligence of just reminding everyone, my least favorite thing to do is to do this ask. However, nonprofits are in a really weird place these days, and we really love our work. We feel like it's very important to Alaska, and if you feel the same, then consider us to click it. That's it.
Thank you so much, Tamar. I know that the Mat-Su Valley really goes out for Go Blue Day. Last year was during the rally, and everybody was covered in blue and yelling from the street corner. They had signs and everything going to come up. And so we will be channeling your energy from Mat-Su Valley to be doing that up in Fairbanks. I remember Dr. Hess had a whole blue scarf and the whole thing. So you all go out, way out for it.
Yeah, also on that April, that first Friday in April, they have a Go Blue rally at the corner of, I think it's the Cruzy Street and Parks Highway. So there's a ton of people out there.
Nice.
Okay. So I'm just gonna give an update on Ptarmigan Peds, and a little bit later, Kathleen will talk about Ptarmigan Connections and her stuff, what she does. So at our clinic, we have currently have 7 pediatricians. Actually, I think one of them is technically I've added that in from us, but she's over at Connections. And we have 8 nurse practitioners between both sides, and 2 of our nurse practitioners are behavioral health background. So if we're having a lot of our docs will take care of some simple behavioral health stuff, and if we're having trouble from a medication management standpoint, we might reach out to them, or child psychiatry in the community, which we don't have a lot of. But we have 1 pediatric neurologist, neurodevelopmental pediatrician. We have 4 speech language pathologists, and I said 1.5 neuropsychologists, because we have one that's working down in Seward. He's doing patients with us from part-time position, and they have 1 LPC. who is also doing training another LPC behind her. So periodically she'll have a student in, or we'll have a SLPA student come in. And so we do a lot of training with and trying to kind of build up community resources. On the PED side, we have third-year medical students from WAMI that come through, and then three other students come in from Pacific Northwest University, kind of scattered throughout the year. The next medical student we got coming in is actually the son of one of our nurse practitioners. He's really excited. It's his son's last rotation in medical school, but somebody got to him first. He's not gonna be a pediatrician, so. We've had, out of all we've been doing them since we opened up, but I think we've only had one student going to pediatrics. Everybody else wants to go into the fancier, like internal medicine or ER or something like that, but our family practice. So I think we have our current student is looking to be pediatric neurologist. So he's about to be in his 4th year. So hopefully nobody can change him.
No, I think he's solid.
They were talking at the hospital about a patient and his ears perked up when they started talking about neurology stuff. So I think he's so.
I'm gonna try to add on neurodevelopmental fellowship after.
Cool. Well, there you go. So our services are like most other clinics. We provide well baby care from newborn up to 18, 19 years old. And if a child has developmental issues that need to be hang on to a little bit longer, but then there is some med peds in the community. We'll try to transition our older kids over to them or to family medicine. We do acute care. When COVID happened, we basically siphoned off a section of our clinic, and that's where all our sick kids go. Now they can go on either side of the clinic, but if the provider's not there, we kind of try to put them in acute care so they can see whichever couple of providers are available at any one time. Do sports and school physicals, we had neurology and neurodevelopment, genetic evaluations. And with our speech folks, they keep pretty busy with the speech, not just, they just run the gamut of everything speech can do, but they also do FASD evaluations. So we have a team that gets a couple of FASD appointments in per month. So, and neurology, neuropsychology is part of that. And of course, we do lots of immunizations and look forward to every time Sue comes, we can see what new vaccines are going out on the market. And then we do some procedures. We have a PED specialty clinic that comes to the Valley, or that we set up upstairs. It's basically these specialists from Anchorage come out, some of them are once a week, some of them are once a month or every other month. The one we're about to lose is family dermatology. They're gonna go back to stay back in Anchorage because their clinic is down to one doc right now, and it's hard for her to go back and forth. And then South Central is the newest clinic out here. They come out every other month right now. First clinic that they had out here was in December. They were basically just seeing our patients here at Ptarmigan while they were trying to get their feet wet and making sure all the processes are good. Now they'll be opening up to every clinic in the Valley. So if you have kids that need endocrine care, or if your own family has kids that have endocrine care needs, Providence still has that in town, but they have this South Central they'll send out one, and you don't have to be native. They'll see non-native kids over here, and then they have a team that goes to the Benton, Utah for that, for native beneficiaries. So that's pretty cool. And another month or two, we're hoping to get peds neurology, an additional provider out here. So, and then there's always, if you guys know people, Providence has GI, they have pulmonology. They used to come out here like way before COVID. So if you guys have friends who have patients that go to their clinics, they put that dig into, hey, I'd like to have you guys come out to the Valley so that we don't have to go all the way to town. So it's always good to people press from a patient standpoint.
Although we do have TCI with Alaska Pediatric Specialty.
We do, and Dr. Semantic he comes out monthly, but and that group is growing, so they may be able to add more
I'm
days.
working on trying to get Melandra.
Yeah, they're adding 2 new GI docs to their clinic, hopefully in the fall. So that'd be cool. Anyway, that's Ptarmigan.
Thank you, Dr. Hess. And with that, Dr. Marshall. Yes.
Okay, I think I probably have talked to everyone in this room, although I've only emailed. I talked with you and I was very excited
Yes.
We can talk
Great to
more
see you.
later. So I've had a lot of people, including other doctors, be like, you're not a neurologist, right? You're a pediatrician. It's like, close, I am a masochist, and so I'm gonna tell you a little bit about what I do and how I continue doing a lot of training and did peds and did neuro and did neurodevelopment. Because it gets confusing really fast, so. We're gonna be super fast, education and training, medical school, right, gotta be a doctor first. Did my peds residency, University of Maryland, adult neuro, concentration in child neurology at Hopkins. Did neurodevelopmental disabilities. They're in the process of changing it to neurodevelopmental medicine, but things are slow, so it's still NDD. At Kennedy Krieger Institute, and that was like a combined residential fellowship with neurology. What did I do there? What is this neurodevelopmental disability training that we talk about? So neurology, genetics. So it's very important to know what the normal physiology of the brain is. So at every developmental marker. So if you have a traumatic brain injury at 3 months old, that's very different than if you had it at 2 years old. What's happening in the brain and what's developing is completely different. So kind of looking at it from that way. So I look at neurology through the eyes of development, development through the eyes of neurology, and I don't know how to undo that. I don't think you should. So what kinds of patients do I see? Biggest question I get. Who do you see? So neurodevelopmental disorders, which we just said, well, what is that? Nice fancy name. So developmental delays, autism, neurogenetic syndrome, which may not be diagnosed. They do a lot of genetic workups. When I first came here, about 5 years ago, maybe, no one was really doing genetic testing. And I am super excited to say, I think that we've really caught up, and now it has been standard of care to do genetic testing on any child who has multiple congenital anomalies, intellectual disability, or global developmental delay, or autism for at least 10 years, 15, at least 15 years. And now I'm seeing it very more consistently. And also to add, doing genetics in our patients with cerebral palsy with an unclear etiology. Epilepsy, seizures. And I do consider that a neurodevelopmental disorder because I have never seen someone who has epilepsy that it does not affect their cognition, whether even in their development. A lot of times it'll be like, oh, it's just ADHD, we don't need to worry about it. Yes, but that's still part of their development, and that's going to affect school, it's going to affect everything, and then medications can intervene, cross-react or not. There's a lot more questions there, so I include that as a developmental disorder. Cerebral palsy or abnormal tone, so you don't have to wait till the diagnosis of cerebral palsy is made. You can just be like, this kid's tone is not typical and I need help. That's actually how Chelsea and I met, about talking about various different kids who had really increased tone, or some kids that were moving all over the place involuntarily at like a couple months old. It's like, okay, we know that's not typical, now what? So I like to try to work collaboratively as much as possible. And so get ROIs from families, and then like if we start a medicine for tone, well, then I can call Chelsea and be like, okay, what do you think? Sorry, I'm using your name so much because I called this company, wherever that may be. She chose to sit, no, I chose to sit next to her. I'm sorry. Should have wondered. Children after neurocritical injury. So that includes hypoxic ischemic encephalopathy, so HIE around birth. A lot of our kids post-schooling. All of our NICU and PICU graduates. Okay, I say all, but it's a respiratory thing. Maybe they don't. But a lot of times NICU and PICU graduates, like if they go to like a neurodevelopmental or neurological rehab center and they're going to Shirley for rehab, they come back. You're gonna be like, okay, so I have this kid back as a pediatrician and they need PT, OT, speech. And then what? Like, how am I supposed to deal with that? That's a lot. And also all of the recommendations are changing all the time. So, that's when I'm happy to be a part of the team and be like, okay, let's figure that out. And see who else we need to bring in for the child's team. Traumatic brain injury, at any age. So I have a young lady who is 18 and has remote history of TBI, but still has seizures. And that is hard to explain to a typical adult neurologist because they're thinking, oh, okay, yeah, seizures, okay, let's do this. You have to think about it from the developmental standpoint. Okay, if this happened when you were the X years old, then, you know, this part of the development was affected and we need to think of X, Y, and Z. You feel free to look at this later. I'm not going to completely bore you. This was a big part of my research in training way back when. In terms of, they've done multiple studies looking at the percentage of individuals in the NICU or in the PICU who either have a premorbid neurodevelopmental disorder or after discharge, they're gonna have a new diagnosis of a neurodevelopmental disorder. And it's only increasing as the more technology we have, the more understanding we can do for our kids that they're surviving. That's fantastic. So mortality is decreasing, but morbidity is increasing because more of our kids who may not have survived are now surviving, but we want them to thrive. And I'm a huge, huge advocate of that, and I think every single person in this room is. And that can look different for every kid. I'm gonna give you some examples. Oh, so I've been working with kids with developmental disabilities for about, we're not gonna say how many years, but about 30 years. So this is a picture of Halloween party that we threw. And let's see, do I have a pointer? Or did I just do something bad? Oh, no, it's okay.
There is a pointer in the little circle. It's on the ceiling. It's on the ceiling.
Oh, good. Okay. The more degrees you get, the less common.
You're not showing.
Oh, it doesn't, okay. I was like, I was, okay. Just kidding. So, yes. And this is, I have permission from the kiddo's parent and the kiddo, to share this picture, but I had this because, he was told by multiple specialists in our state, that he would not survive multiple times for about a year. And that they just needed to kind of give up. That breaks my heart, because I don't like anyone ever saying that. I think there's reality where you say, yes, these are the things we're facing. It's gonna be hard. But I try as hard as I can not to be like, yeah, no, there's nothing we can do. He is 2.5 years old now. I've seen amazing things with DMI therapy. And he's able, so on the lower hand, he has HIE, vascular encephalopathy at birth, and subsequent cerebral palsy. The DMI therapy is using his neonatal reflexes purposely and using them to help him learn tone and increase until he can talk more about it. And so can Abby, so can Autumn. I promise there's lots of others, but so he's able to hold his head up in the lower picture. And then he's in a stander. So that was another thing, just talking about the different equipment and various things is huge. Like we really need to be thinking about that. The other thing, I just want to do another shout out for like speech therapy. So using speech devices very early. A lot of our kids are there, and nonverbal does not mean stupid. It just means that they talk in a different way that we don't understand. And they're often laughing at us. You just might not recognize them. So I really try as early as we can to give them a voice. So sorry, I got it in on my passion, my love of my kids. Any questions? Thank you so much for your time.
Next, we've got our friend Colleen Andrews from Rocknet Sioux. She's gonna be presenting virtually today.
There, everyone. Hi, glad to be here with you today. I guess I'm going to start off by promising that I'm going to try my very best to keep it under 7 minutes. But I have a lot of information for you guys, a lot of opportunities to sign up and join us for Child Abuse Prevention Awareness Month. But because I don't have the pleasure of being there with you and talking to you in person, I want to start by telling you a little bit about myself. My name is Colleen Andrews. I am the project coordinator, aka the funstigator for Rocknet Sioux. I've been with Rocknet Sioux for almost 7 years now. So needless to say, I absolutely love the mission of Rocknet Sioux and the Mat-Su Health Foundation. What else? I am Degaton Athabascan, born and raised in McGrath, which sits on the Kuskokwim River. My mother is Kitty Andrews. My grandparents' names were John and Cecilia Andrews from Holy Cross. I am a mother of 4 boys. I am a mother of a child with special needs. I actually just made a note to reach out to you, Dr. Marshall, because my now 17-year-old son lives with many of the symptoms that you were just mentioning in your presentation. So I'm thankful for that.
I'm happy to see him.
What's that?
I said, I'm happy to see him.
Oh, awesome. Yeah, so I'm thankful for your presentation and that connection. What else about me? I am a hockey mom. I'm a deep sea and a river fisherman. I'm a hunter. And I have been a member of the Mat-Su community for about 12-ish years. So like I mentioned, I'm the project coordinator for Rocknet Sioux. So my job is to facilitate conversations about our initiatives and to push the work forward. And so I oversee 2 or 3 of our initiatives that work towards Rocknet Sioux goals, of the overarching goals of preventing child abuse and neglect and to strengthen families in Mat-Su. Okay, so I'm going to be highlighting some of the work that the Rocknet Sioux Collective has done in the child abuse prevention awareness space for 2025. And I guess I should forewarn you that I'm going to be showing you a few sign-up opportunities by QR code. So if you have your phone handy in case, have your phone handy in case you see something that you want to participate in. We can go to the next slide. I show this slide just to give a little background. So in its early creation, the Child Abuse Prevention Awareness Month work group wanted to set some goals that we strive to hit, or I shouldn't say hit, that we strive to reach each year. And that is to increase awareness of child abuse and child sexual abuse prevention in the Mat-Su borough, to further educate the Mat-Su community about child abuse prevention resources, and to increase community involvement. We can go to the next slide. This slide is an overview of the different events that the Rocknet Sioux Collective has chosen to roll out for Child Abuse Prevention Awareness Month. And I will go into each of these and give a little bit more detail. We can go to the next slide. Okay, so Rocknet Sioux is hosting a book club starting on April 3rd, and we will meet about 5 times, and that'll be on a Wednesday from 6 to 8. So every Wednesday, 6 to 8 in April, at various locations. The book club will wrap up on May 8th, and dinner will be provided for each meeting. So I'll just leave that up there for a second in case there are people that want to scan it with their phone. And if you guys have any questions along the way, please do stop me. We can go to the next slide whenever you're ready. So Rock Matsu is hosting a second Community Connection Carnival. We hosted one last April, excuse me, and it was a huge hit in the community. We had over 400 people attend. 23 different community partners participated, and there was so much happening in that space and people really enjoyed it. So we're doing it again this year. The overall intent of this event is to connect with Matsu families to spread awareness of the participating organizations that work with children and families and to have some fun. We can go to the next slide. This one is one of my favorites. So every year, Rock Partners, along with organizations across the Matsu Valley, welcome newest residents and try to give them the best start possible by hosting a community baby shower. And I think one of our baby shower champions is in the room. Shout out to Mark. The event itself is meant to provide an opportunity for parents to connect and to give parents an opportunity to add skills to their parenting toolbox. The QR code is for bag registration. If there is a pregnant person or somebody who has had a baby within the last year, they can sign up to receive one of our gift bags. Let's see. Our gift bags house several quality items that could be used during the first year of life. And any organization is invited to put logoed or non-logoed items in that bag. And you can participate during our event as well if you'd like. Next slide. So this slide is representative of the different trainings that Rock Matsu is going to host in 2025 for Child Abuse Prevention Awareness Month. I will say one slide that I forgot to include was the Darkness to Light training that we will be hosting on April 18th here at the Matsu Health Foundation from 9 a.m. to 11:30 in the downstairs conference center. And we can go to the next slide. We are going to be hosting or facilitating a combined PACES and Raising Resilience training on April 29th from 5 to 7:30 at the Matsu Health Foundation building in the downstairs conference rooms. We are asking that people register for this one only because we are providing dinner. We can go to the next slide. The QR code is for, I think, for the Facebook page. And then, so this slide, in April, we're going to be hosting a Braided Stories training on April 9th and 10th from 8:30 to 4:30. It's a 2-day training that will be held here at the Matsu Health Foundation. And the QR code is for sign up. We'll go to the next slide.
I think that was the last one, Colleen.
Oh, last one. Cool. How did I do?
You did great.
Did I keep it under 7 minutes?
You did wonderful, yes.
Thank
Thank you
you.
so much, Colleen. Can I just also give a big shout out and encouragement? Colleen and their team at Rock Matsu have done incredible work with baby showers, and it's become something across the state that communities are learning from and wanting to do. And so I know Colleen's name and her team has been out there as well as across the country. So the baby shower work that happens out here in the Matsu Valley is really getting a lot of attention and encouragement, and people want to do it because it's been so wonderful. So congratulations, Colleen, and your team at Rock Matsu for all the great work that you're doing with that.
It takes a village, but thank you.
Right, next we have Kelly Newman from Lynx.
And our team.
And our
so,
team, yes.
Casey and Mary. Hello. Hello, everybody. Thank you so much. As I introduced myself earlier, my name is Kelly Newman. I'm the community director, or the outreach director, and employer. See, I can't speak.
You have a very long.
Right. Employee enrichment director, with Lynx Resource Center. So, a little bit about myself. I started as I've been in the field of, developmental disabilities for the last 35 plus years. And I moved over to Lynx Resource Center just a couple years ago. I was a community health worker. I started off with our HUMS program. And then moved into the role last year as a outreach director. So, and this is Katie.
Oh, yes, Katie Towns. Let's see if I can say it right this time. So at Lynx Resource Center, I'm the Community Parent Resource Center Director. I've been with Lynx just over 2 years. Previously, I was with CCS for quite a while. So that's kind of my background, early childhood education, and then I'm also a parent of a child with disabilities.
My name is Mary Beck. I'm a parent advocate at Lynx. I've been with Lynx since January, and I also have a son who has a disability as well, so.
Okay, so just to tell you a little bit about Lynx Resource Center, we started close to 32 years ago, just from like a couple parents sitting around the kitchen table saying, you know, hey, we're not getting the needs met. We really need to help out our parents, our other you know, colleagues in this, and so they got together and they started what the Community Parent Resource Center and Lynx as a whole. So we are a nonprofit organization that is dedicated to our community out here in the Matsu Valley. We support families with that have children with disabilities. We support the whole family, and then also seniors and veterans in our community. So our mission is to provide resources, advocacy, and connections to improve lives. Our vision is to empower underserved Matsu residents to have their basic needs met, achieve independence, and thrive within their community. So, all right. So this is us at one of our, this was at actually the Palmer Community Resource Fair that we had. And so we go out and we try to immerse ourselves into the community to make sure that people know about our resources and what we provide. We go to, I mean, we're busy. We are all over the place. We try to go into all of the schools. We go into a lot of the agencies doing presentations. We enjoy going out there and making sure that all of our community members hear about our services. So, and then we also, you know, like I said, we work closely with the Matsu School District, other community agencies. So we like to collaborate with all of you. So just a little overview of each program. So Aging and Disability Resource, and we're going to dive into each one a little bit more. Aging and Disability Resource Center, so it provides assistant individuals to access resources and services. So they work with mainly with seniors and people that are disabled that are 18 and plus. So and then the Community Parent
Resource Center, Katie and Mary are gonna dive into that a little more. We have the Veteran Directed Care Program, just empowering our veterans to make, you know, if they want to stay in their home, they can remain in their home, so they don't have to go into an assisted living facility. We have the High Utilizer MATSU program, which is HUMS for short. I know some of you probably already have connections with them. And as I said, we also do community engagements. We host social groups. We have resource fairs. We do, we have Medicare and Social Security workshops. And then also we volunteer as much as we can in our community as an agency. As I said, I'm sorry, I'm looking up. So I apologize. This is like my second presentation, so
You're doing great, Phil.
The Aging and Disability Resource Center, ADRC for short, so there are ADRC programs in Anchorage, they have one in Fairbanks, so they have them throughout the state. And that our ADRC program out here in the Matsu goes throughout the whole region, so we go everywhere. The Matsu is, or the Matsu, or all the area, yeah, the whole borough. And so they, we have our Social Security specialist, Rob. He goes out, he's gone out to Squetna, does outreach at, up in Talkeetna. He does outreach, up in Glacier View, so all over our Matsu borough, he is everywhere, so. They provide free information and referral services for, people that, need like housing applications completed. Social Security, we have a Medicare counselor who, helps them guide them through that, open enrollment. They also, so if there's, children or, but, people that need in Social Security disability and helping them navigate that, that program, we have Rob and, the resource specialist there can help navigate them through that. So we just want to make sure that we empower our individuals that live here in the Matsu community to live independently and safely.
Yay, my turn.
Yay.
So the Community Parent Resource Center, we serve families in the Matsu borough. Right now our program is just all two of us for all 50 schools. So we are very busy, but we love it. Some of the services that we offer is advocacy for families. So they get a new diagnosis. They're told that they need to do something with this diagnosis. Usually it's neuropsych. What do we do with it now? All this language that they don't speak, special education, medical terminology is a totally different language than most parents understand. So our job is to come in, help them go through that paperwork, help them make a plan for what's next, connect them with the community resources, get them connected with special education, and help them navigate through that process as well. We do workshops and trainings. So we do training for the professionals at the district, as well as community professionals and parents. We have online trainings on our YouTube channel as well for parents and professionals of all different topics. Let's see what else. We do a lot of referrals. So we work really closely with Stone Soup Group. They're the TTI for the state. So they're the ones that is not like serving the direct valley. We refer them out to Stone Soup Group. Or the other thing is we don't do any kind of waiver services. They go straight to Stone Soup Group for that. Some of the other things we do, we have social groups twice a month. They're for families of students with individual or with IDD. And yeah, like this one. So we do those twice a month. We ask that families pre-register just so we kind of have an idea of how many to expect. Because we usually provide food, snacks, that sort of thing. And we encourage families to just come and bring their whole family. We don't require like proof of diagnosis, anything like that. We do get families that ask that. We're not going to question them and make sure that they're, supposed to be there or anything. They're welcome to come. And they don't have to disclose any of that information. And something even is just like maybe a behavioral challenge. Please let them know about this. It's just really, really great to allow them to come together in a safe space and have that interaction with other families who have been sitting in that same chair and not feeling that judgment. So I think that's, and we also do friendship and dating class, which is for 18 to 24. Right now I'm partnered with the school district through their Project Life. And so that teaches about like healthy relationships, healthy boundaries, and then, you know, friendships as well. I think that's it. So, and we do all kinds of like special education navigation, not just IEPs, not just 504s. We'll do behavior plans. They don't have to actually have an IEP to be, you know, to receive our services. If they just have a concern, we can help them get that concern addressed at the school. So we just kind of, where do I start? We kind of help them, guide them along the way. Okay.
No, I don't think so.
Okay. Any questions? Moving on.
Okay, so, as I said, we also have our veteran directed care program. I'm just gonna like just say a little bit about that. It's pretty much, it's through our, they get referred through the VA. So it's the person, the veteran will need to have, the primary care provider being a VA primary care provider, they would get referred to the veteran directed care program if they meet that level of care for like a nursing facility. So what this is, for the veteran, if they do not want to go into a nursing care facility, they can stay at home, remain in their own home, and they can have like a friend or a spouse or some kind of care provider remain at home with them, help them with their care. And if they get paid through the veteran directed care program so that they can remain home with that veteran. So as I said, the eligibility enrolled in the Alaska VA healthcare system, has a VA primary care provider and able to self-direct their care. So they have to be able to make those decisions to direct their care. So if you guys have any more questions on that, I can refer you to our, Thomas and Dawn are in our VA, or the veteran directed care program. And if you have any questions, I can refer them to that. Sorry, I'm just stumbling over my words. And then we have the high utilizer MATSU program, HUMS for short. This is referrals from the emergency room department. They have, they noticed that there was some overutilization. So, for people that were people were, I don't want to say repeat offenders because that's not what but people that would repeatedly go to the ER, and they weren't, needed necessarily the ER, the emergency services. And so they started this program back in 2018, in conjunction with Matsu Regional and the Matsu Health Foundation. They saw that there was a need for that, for this program. So the clients get referred through, whether it's a social worker, the emergency room doctors, or the nurses there. They we get the referral, we reach out to them. It's all voluntary, so they don't necessarily have to be part of that program, but we reach out to them to see if they need assistance to their doctor's appointments, if they need to make connections with behavioral health team or primary care providers or dental, whatever their need is. They also assist them with housing applications. I mean, they just kind of look at the whole person and not necessarily just one piece of the person. So also helping them with, if they have food insecurity, helping them, guide them through that program. So they also collaborate with the mobile crisis team. So if there's a crisis, usually the mobile crisis team is called out. They will, once they work through the crisis with that family or with that client, they will do a warm handoff to one of our community health workers who are a post-crisis specialist, and they will reach out to those clients and help them work through that crisis, trying to figure out how to prevent the crisis again. So okay, so that, do you guys have any questions about our programs? We'll just move on, so. So we have our Links Resource Fair coming up. I'm not sure if any of you heard about our Links Resource Fair, but this is our 3rd annual Links Resource Fair. We had it at in the back of the first one, we had it in the back of our building. And we had about 30 vendors there that year, 35. Last year, we had close to 70 vendors, local nonprofits, not vendors, but local nonprofits that came and participated. Now we're reaching for the stars. So we're looking at, we want to get like 100, nonprofits, for-profits, if you want your service, to have a booth there and you want to provide, our community with what you offer, then we would love to have you there. We have a link that's down there. I don't have a QR code with that link. Katie reminded me, she's like, oh, do you have a QR code? I'm like, no, I'm sorry. So, but if you have any questions about that, you can definitely reach out to me and my, I'm sorry. Oh, so my information is here. So if you want to get on that registration, then you can just reach out to me at kelly@linksprc.org. You can call me at that number at my office, 373-3428, or on my cell, 315-3596. So we just want to make sure that we connect with each other, collaborate with all of our agencies and our local nonprofits and for-profits out there. So connecting with it. I do have a QR. So that's our Facebook page. So if you guys want to follow us on Facebook, we put all of our events. We put fun things out there. We do fun things at our office. We had February, we had a dress up theme Friday, so hats off day. We had dress as a Valentine. We had sci-fi tech day, and then we just had our Fiesta Beach Day. So we put all that information out there, and just to let you know that we are a fun-loving group. So it's a group of 20 of us that provide all of these services throughout, and we are basically funded. We don't bill Medicaid. The service is free to our clients, and we're basically funded through like private donations from private funders and out there in our community. So, well, thank you.
Just gonna add to that, we have some of our social group flyers up here for some of the upcoming ones. Kelly has our links resource fair flyer up there. And then also up here is the QR code. CPRC has a peer support group for families of children with disabilities within the Matsu Borough School District. We post all of our trainings on here. We post all of our resources, all of our events. So if you want to grab a couple of these for your families, you're welcome to as well.
We have pens on the table, some swag, your pens, we have some hand sanitizer. So help yourself to all of that, and thank you all so very much.
Thank you so much. That was amazing. And I always love when there's free swag. And thank you about the Links Resource Fair. That's incredible. 100 vendors. I am confident that people will show up. We'll put that link available on our website. So for those who are interested, you can be able to get in touch with them.
Okay,
next we have an online presentation from Sally Rue with Alaska Be Smart.
Thank you. Can you all hear me okay?
Yes, we can.
Okay, great. My name's Sally Rue. I live in Linkitani, which is otherwise known as Juneau, Southeast Alaska. And I'm a volunteer with Be Smart, which is a secure gun storage promotion campaign. And it's under the sort of the grassroots group of Moms Demand Action for Gun Sense in America. And we have an Alaska chapter, which we have probably about 2,500 supporters in Alaska. And nationwide, Moms has chapters in 50 states, all 50 states. And they're about up to 11 million members. And it's a grassroots organization. It's not anti-gun. It's about keeping kids safe. So Be Smart is a nonpartisan sort of educational campaign, and that's I'm a volunteer. Have been doing this since about 2018, and I think the first time that we talked to A2P2 about Be Smart was February 1st, 2019. And unfortunately, gun violence rates have gone up since then. But so I don't know if how many of you were around then, but I'm really happy to do it again. So let me just say that I've lived in Juneau for, well, many years and raised 2 kids here and have 5 grandkids now. And I also was involved as a school board member and various things. So I've sort of been an advocate for kids for a really long time. Could you go to the next slide, please? And I'm also a gun owner, by the way. Many of us members of Moms Demand Action and who work in Be Smart are also gun owners. So as I'm sure you all are well aware, guns are the leading cause of death for Alaska's kids and teens. And 55% of these deaths are suicides. So, we have really just unacceptably high rates. And so that is one area where we are trying to partner with people and really sort of, when you have secure storage, you reduce suicides and you prevent unintentional child shootings, of which Alaska has the 7th highest rate in the country. And I look at those as, virtually 100% preventable. If all of us who have guns lock them up securely and children couldn't get access to them unsupervised, you would really prevent probably 100% of those child shootings, of which nationally there's like 360 every year. And those can be kids as young as 2 years old get hold of a loaded gun. So Alaskans, obviously, we all know we have a high rate of gun ownership. And I think 57% of Alaska adults have guns in their homes. And 10% of Alaska adults live in a home with an unlocked and loaded gun. And not all of those obviously have children in the home. But that's one of the things that we are really trying to get across, really, like we've done with tobacco and seatbelts, make it a cultural change of how, if you have a gun, what you do with it, how you store it. And Alaska's gun death rate has increased by nearly 50% since Columbine happened, which I think was 1999, maybe. Okay, the next slide. So Be Smart for Kids is, I'll explain it a little bit more, but it's an educational program, nonpartisan, to just get people to voluntarily secure their guns when they're not using them. And it's based on the idea that it's an adult responsibility to keep kids safe. It's really good to give kids hunter safety, gun safety courses and stuff. But research shows that you can't just tell kids to never touch a gun. And research shows also that a lot of kids know where guns are hidden or stored. And enough, like 30% of them have touched them, even though their parents say, oh no, my kid has never touched a gun. So we believe it's an adult responsibility. And so we have, I'll explain the SMART in a minute, a little bit more, but we have a lot of materials and resources that we get from national, besmartforkids.org, and they're a great resource for stuff. And we've Alaskanized things. So let's go to the next slide, please. So Be Smart, it's about keeping your gun unloaded and locked up, separately from ammunition, preferably, ensuring that kids never have access. So secure all guns in your homes and vehicles. Gun theft out of vehicles has become a huge problem nationally, and I think probably also in Alaska. So we're trying to change the culture of, if you carry a gun in your car, there are ways you can lock it up. And we try to promote with people the various kinds of methods that they can secure guns. And in fact, we partner with the VA Suicide Prevention Office, and they actually have been providing us with cable gun locks that we provide free to people. So the M stands for model responsible behavior around guns, which obviously is really important. And ask about the presence of guns in other homes. And that is something that a lot of the work that a lot of you do could be really critical. And I mean, I know some medical providers routinely ask about families if they have guns and how they store them. And we've partnered in Juneau and Anchorage and various places with, medical clinics who have, posters on their walls and have Be Smart information that they can give out. And some of them are actually also having gun locks that they can provide. And when we do a lot of tabling in schools and have had great partnerships with schools and getting this information to parents, some districts have, sent home to families our Be Smart cards and stuff. And one of the things is we often table at like open houses at the beginning of school. And one of the things that people say, oh, don't worry, I lock up my gun or I don't have a gun. And you ask them, it's like, well, does your kid ever go to somebody else's house to play? And sometimes you can see their eyes just get wide and they go like, oh my gosh, no. And I have to admit, when my kids were growing up, we had guns in our house and I never thought to ask when they went to somebody else's house how they store their guns. But my daughter does that routinely. And I think that's what we're trying to do is make it a part of normal conversation to ask that. And a normal part of conversation between, medical providers and patients about making sure that they're aware of this. So the next one that's I think really critical is recognizing the role of guns in suicide because guns are 90% effective when people use them in suicide. And other methods are like 4% effective. So it's really critical to, when somebody's in crisis, to not have an accessible gun. One of the things that I on the slide I didn't mention, that the second slide is that research shows that there's a high rate of suicidal ideation among high school students. And, many students, nearly half reported that they could get access to a gun in a very short time. And so, especially with young people, so much of suicide is really an impetuous act that being separated from lethal means for, even a short time can actually change the outcome. Okay, let's go to the next slide. Can we go to the next slide? Yeah, great. So as I said, increasing public awareness is really critical, and we've been working on that for since 2018. And so we have volunteers. We have lots of volunteers who all of us are volunteers actually, tabling and presenting at schools. And we can work with folks in outlying school districts, and we can coach volunteers. And we just continue to do this wherever we can, work with hunter safety and education, veterans. And in fact, the schools have, as I said, have been a very important venue for us to reach families. And some districts have actually adopted resolutions promoting safe storage, secure storage information, to getting it out to parents and encouraging schools to do that. And there's actually the School Board Association a couple of years ago passed a statewide resolution encouraging districts to do that. So that's been a really positive way to reach people. So we go to the next slide. Thank you. So we also do a lot of partnering with healthcare and suicide prevention and injury prevention organizations and tribal groups. So that's, like I said, with you guys starting in 2019 when we were just starting out. And we're working increasingly with Department of Health and ANTHC and public health nurse in Juneau has started taking out our Be Smart information when she goes out. She's itinerant. She goes out to outlying communities and takes that information. And the Juneau Suicide Prevention Coalition in Juneau, and they're working all around Southeast. They are now taking our information out. So we try, we're all volunteers. We don't really have the ability to get out to work communities all over Alaska, but through schools, through, health organizations, and through a lot of partners who are willing to help promote this idea of securing firearms to keep kids safe. We are really increasing our reach. So I would invite you to if you would like materials for your facilities, for if you have tabling opportunities, you've talked about some of those. We would just like to keep expanding our reach. We have an active Anchorage chapter of Moms and Be Smart, and we also have are doing more and more statewide. So anyway, I would like to offer this, the materials that we have, and free gun locks, and invite you to partner with us to keep that up. Any questions on anything so far? Okay, next slide, please. So this is one other thing that we do besides Be Smart, and it is advocacy on policy and stuff like that. And I just wanted to make you aware that we have over the past several years worked for passage of secure storage laws, and with no laws have been passed, but we're always trying to get more public conversation about it. And there is a bill that's actually been introduced this year again for extreme risk protective orders. And it's HB 89 and is actually coming up for a hearing on Thursday, March 13th. And I just wanted to make you aware of that. So it'd be in front of House State Affairs Committee. And I'd be happy to, if people want to get in touch with me afterwards, I could get you more information, but I put a little bit of, and thank you, Rianne, for getting this into the slide deck, because I just did this morning, because we just got word that there's going to be an opportunity for public hearing. So we're really pleased about that, because I'm sure it won't pass this year, in the first year of the session, and but we just work on it and over time. And I think, like the rest of Alaska in the legislature, we go and talk to them and try to educate them on this. And it feels over time like they're much more willing to start having this conversation. So we're really pleased that there's actually going to be a public hearing. So it's important for them to hear from people who feel like gun violence is a problem that we need to address in Alaska, and certainly suicide, and unintentional child shootings. So anyway, I think I've pretty much used up my time. So the next slide actually just has some contact information. So if anybody has questions, I'd be happy to answer them if there's time. And if not, feel free to get in touch with us. And I really appreciate this opportunity.
Sally, this is Rianne. So people can contact you directly, like pediatricians or offices, clinics can contact you directly about getting those gun locks for them to hand out?
Yes. And that would be this email right here would be good. Alaska Be Smart for Kids. And you guys are up north. So Rochelle Parker is the Be Smart lead in Anchorage. So we could definitely do that. And what we encourage people, if they have gun locks, to also give out our information, which basically is just pretty basic about the principles of Be Smart. And so yeah, we'd be happy to do that.
Thank you so much, Sally. This is wonderful information. We appreciate it.
Oh, well, thank you all for the opportunity.
We have one last presentation from Stephanie Tucker with the Matsu Services for Children and Adults.
Hey all, I apologize for my voice ahead of time. I would be in the room with you, but I sound like this, so I'm not. And yeah, I'm representing Matsu Services for Children and Adults. I'm going to give you a brief overview of the whole agency, and then I'm going to launch into a little more detail about the infant learning program because that's more pertinent to A2P2. Matsu Services for Children and Adults serves folks from birth through end of life. We serve folks with intellectual and developmental disabilities and delays. And we cover a lot of, we do a lot of waiver services. So we'll provide job coaches and group home supports and direct support professionals in the community, different things like that as an agency. But specifically, I'm going to talk about the infant learning program today because that's my bailiwick. For the infant learning program, referrals can come from anyone at any time. We serve children from birth to 3 years old, so it's a hard cutoff when they turn 3. Our program is out the door. We're funded through the Individuals with Disabilities Education Act, and so at 3 years old, they move to school district special education services instead. Let's see. We offer developmental screenings, so we've been doing that at the Ptarmigan multi-care clinic once a month, and we intend to start doing some screening days at some of the CCS early learning Head Start sites over the next couple of months. When we try to do a screening about monthly, we'll do a full developmental screening, but we can also do STAT screening, which is an autism screening that's appropriate to the youngest kiddos. And that's usually helpful in providing that diagnostic piece because it's one more piece of information that's a little more appropriate to young children than say an MCHAT. We can do screenings at any given time, but typically we move straight to evaluation if we're not at a screening date. Developmental evaluation. So when a child's referred to us, we have 45 days from the date of that referral to see that child, evaluate them, and enroll them in services if they're eligible. It is per parent request. So if you refer a child and the parent declines, just refer again. We'll keep contacting the parent sooner or later. They do come through and they do let us evaluate. But if you have real concerns, keep referring and keep talking to the parent about why. Because if they say no, then we will not go in. For children who meet the qualifying criteria for enrollment, we have ongoing services. Those are usually in-home visits, but it can be community visits, it can be virtual visits, it can be office visits, it can be a lot of different things. It is based on following a family and parents lead. And so it's at their discretion based on the goals that they want to pursue for their children. And we continue those ongoing services up to 3 years old as long as the child remains qualified. Next slide, please. Our staff consists of developmental specialists, therapists. So we have an occupational, a physical, and a speech and language therapist. We also contract with deaf and hard of hearing specialist and a vision consultant. And then our service delivery models, we use a kind of a blend of whatever's best per family. So we really individualize to the family, but some of the things that we're trained in are circle of security parenting. So we can facilitate circle of security parenting courses. We use facilitated attuned interaction, which is kind of it's a model for home visiting. DIR floor time, which is about following a child's lead and connecting with them. And neuro-relational framework, which is about looking at different brain and body processes as they interrelate with the child, and then how that corresponds with their relationship with their parents. And we always use reflective practices, both with families and for ourselves. And we coach parents. We are not like traditional therapy. We are there to coach parents and embed interactions or interventions into everyday life. And so it looks a little bit different than your typical therapy model. Next slide, please. So once a referral is received by our agency, let's see. A developmental evaluation is offered to the family, and it's scheduled if they want to have one. Sometimes parents will say, well, we're going to be out of town, so we might pend it a little bit and go longer than our 45 days if the parent has a reason to, but otherwise it's scheduled pretty quickly. And then once we do the evaluation, if the child meets the qualifying criteria, the family is offered ongoing early intervention and we'll start an IFSP or an individualized family service plan with them at that point. It's pretty similar to an IEP at school district, with the caveat that it's about family functioning. It's not about an educational setting. And then a report is written and sent to every family of a child who's evaluated whether they qualify for ongoing services or not. And we will send them to providers as well, but we do need a release of information in order to do that. So we'll try and get that usually during our visit when we're doing the evaluation, but sometimes we don't. Sometimes you'll need to get it. Next slide. Next slide, please. Eligibility at this point in time is a 50% delay in one or more areas of development, which is pretty severe. That's a big delay for a young child. They can have a qualifying diagnosis as identified by our state ILP office. So we have a list of diagnoses that qualify automatically, whether the child has that 50% delay or not. The reason for those qualifying diagnoses is they are considered statistically significantly likely to result in a 50% delay within the first 3 years of life. And then finally, we can use informed clinical opinion, and that's determined by the eligibility team and approved by me usually. And that means a child didn't hit that 50% delay, but we really feel like the quality of their skills is questionable and that there are some extenuating circumstances where we really believe that they're going to be at a 50% delay pretty quickly without intervention. That is where other providers can come in. So if we see a kid and we give you the report and it says, sorry, this child doesn't meet our standard yet, because maybe they have a 40% delay instead of a 50% delay, please call us and push us on that. Because if you can give us a rationale that we can use to prove why we want to enroll the kid, even though they're not at a 50% delay, we will do that. There is currently legislation on the table this season to change a bit of this for us, but it's going to be a few years in coming. But we are looking at changing to a 25% delay in the next couple of years. So we'll see if that happens.
Sorry to interrupt. This is Dr. Marshall. I just wanted to ask, how can we help with that? Because I'm from Baltimore where it is 20% delay.
Yeah. So I'll get to that at the end.
Okay.
I'll get to that at the end because there's this huge legislative push for ILP this year. And so let me get through all the slides and then I'll talk about what you can do because there is a lot right now. I'm sorry, is there another question?
No, go ahead.
Okay, next slide. So all agencies in Alaska follow the IDEA regs. And within that framework, though, we each operate in a manner that suits our population and our area because we're all really quite different. But we are all guided by the same 7 key principles. I'm not going to go into detail on them, but I'll show you all of them. Next slide, please. So principle 1, infants and toddlers learn best through everyday experiences and interactions with familiar people in familiar contexts. That's why we do home visiting and community visiting. Next slide. Number 2, all families with the necessary supports and resources can enhance their children's learning and development. Research says that children learn best in a safe and stable relationship, and that's why we embed intervention into daily life rather than doing separate therapy with kiddos. Next slide. The primary role of a service provider in early intervention is to work with and support family members and caregivers in their children's lives, and that is the focus that we go in with. We're there to come alongside them, not to judge or guide. Next slide. The early intervention process from initial contact through transition, and transition is when they move into school district at age 3, must be dynamic and individualized to reflect the child's and family members' preferences. So we really work hard to work within the culture of each individual family and to suit strategies and interventions to their needs and their lifestyles. Next slide. IFSP outcomes must be functional and are based on children's and families' needs and family identified priorities. So sometimes our goals do not look like one would expect from where the delay is. That doesn't mean we aren't working on the delay. It means that for the parent to buy into the embedding, it needs to address a need that they have with their child. And so all of the goals are written around what the parent needs to work on next and really prioritizes. Next slide, please. The family's priorities, needs, and interests are addressed most appropriately by a primary provider who represents and receives team and community support. So a developmental specialist will be assigned to a family. Generally speaking, that person will see them through from entrance into the infant learning program all the way through with transition out by the time they're 3. We do bring in our therapists, but we bring them in a consultation model so that they still have that one primary person who is kind of holding the whole story of their child with them. Next slide, please. And finally, interventions with young children and family members must be based on explicit principles, validated practices, best available research, and relevant laws and regulations. So we're constantly attending trainings and updating how we do things. There's lots to be said about reflective practices and the changes in how early intervention works, especially in light of the more recent set of research about children developing best within relationship with a trusted caregiver. And so we really tailor around that, and we keep going to trainings and updating ourselves on it. And final slide. Family choice drives our services. ILP is present with families to enhance supports for their children within their existing culture, structure, values, and priorities. We avoid judging and or altering their existing culture, structure, values, and priorities. So we're not there to make them change how they do things. We're there to take what they do and make it more. I think there's one last slide with just contacts. Oh, I have more. So our community outreach, we do a lot of different outreach. So we attend all the different fairs that everybody puts on, and we usually have a table at those. And we're usually offering screening and resources to all the different events. And this is just kind of a listing of some of the partners and events that we participate in. Next slide. There we go. And these are just extra resources about early intervention. So that's it for slides. Now to the legislative question. We have bills being proposed in the legislature this year. One, to increase our funding because the infant learning program in the state of Alaska has been flat funded for 13 years, I believe, which means we're seeing way more kids, but we have the same level of funding that we did 10 years ago. So we're stretched a little thin. So the first half of that legislation, or of that, the bills that are being proposed, is to bring us current with our finances. The second part of that is to change our regs to allow us to see children down to 25% delay. That will take a little bit longer to enact because we would need to double our staff in order to be able to take on that capacity. And when the law changes, it's immediate for us that we need to just start seeing those kids today. So we need to have our staff ready. However, that's the legislation that's on the table. Next week, there's actually going to be a call-in. There's $5.7 million being pushed into the budget for us. And they're going to have community call-ins next week. I believe Matt Sue's is on Friday to talk about the importance of ILP and why we want that $5.7 million increase to our programs so that we can come current. So if you want to help us, please help us by calling in and talking about the need for infant learning program and what we do for families. Please encourage any families you know connected to us to call in because those are the most used voices that we need. And then just keep watching. I'll be sending out, or the Infant Learning Program Association will be sending out kind of legislative updates from time to time, and I'll forward those on to partners to say, hey, please call in now because there's going to be a couple of different bills coming through this year, and we could really use the support to change how we operate and to bring us current and to allow us to serve more kids and match up with school district. And then I'm going to do one final bid. Matsu Services for Children and Adults recently took on the Hello Baby Coordinator project from Rock Matsu, and we're very excited. This is an initiative aimed at changing how our community supports and serves families and connects them to social engagement as well as resources. So there will be more to come on that. I don't have a lot to say about it today, but just watch for Hello Baby. There's lots coming with. And then I can take other questions.
Dr. Marshall again, you did absolutely amazing, and I'm so sorry you're not feeling well.
Oh, that's okay.
I was just asking, where can we get more information about the call-in on Friday?
I am waiting to get that myself. I'll send out emails on Monday with it should have the call-in times and numbers. There's also, you can do a POM. I forget what that stands for, but it's kind of a written or video send in.
Okay.
Yeah, and I have an email coming from the Infant Learning Program Association, which I will share with everybody.
Because I have a whole group of moms of children with special healthcare needs that I will let them know to call on Friday.
That's awesome. Yeah, we'll be down for the Key campaign in Juneau in a couple weeks because ILP is the main platform for Key campaign this year. One of the things that would really help on call-ins would be families who didn't qualify for services but should have.
I have them too.
Yeah, that'd be awesome.
Awesome. Thank you so very much, Stephanie.
Thank you.
Thank you. Wow. I feel like we always need way more time for these partnership meetings because we all have so many great things to share. We have time to partner with one another. Thank you for your extra time today. And thank you to all of our wonderful presenters. I feel I was just like taking notes on my phone. I'm like, oh my gosh, I have so many follow-up questions and people to connect one another with. So thank you all for everything you have to share.
I did want to say, the Mental Health Trust does, during session, they do Friday advocacy calls with legislation related to their beneficiaries, which includes children. So if you want to learn more about different bills that are currently that are in at the legislature, then those are anyone can join those. And if you need information on how to join those, I'm happy to share that. And also on the chat, and we'll send it out in an email. Erin Moya from Seattle Children's just posted a link to a webinar related to a recent measles case that came up in Washington and Seattle. And so they are putting on a webinar covering topics at a high level that are broadly applicable and not just specific to Seattle. So just sharing in case anyone would like to join on that as well.
Excellent. Thank you. Tamara, so we do have information on Help Me Grow Alaska here in the room. We've got our table here. Help Me Grow Alaska is our public facing outlet from A2P2 and Help Me Grow, and it's a resource and referral to be able to connect families 0 through 26 to resources, whether it's referrals, activities in the community, things that families might need. A lot of times we get families who call like, oh, I need this referral, but also here's all these other things I'm going through. I'm looking at Kelly and her team at Links. You guys are somebody that we refer to as well. We have a lot of partners around the state that we're able to send families to. And we have family support specialists. We have 7 of them, and they're incredible. They're so kind and caring, and they do a lot of the calling and the footwork that our barriers usually like. Do they take my insurance? What's the wait list? And our wonderful support specialists are able to support families in that. We've got lots of resources up here, including books, information on Help Me Grow. our PalPac line, we've got some information on this. Dr. Has talked a little bit about the psychiatric support that you all provide one another here in the Valley. We also have that through Seattle Children's Hospital where we can connect you to psychiatrists to provide that reflective conversation about support for clients and patients. And our next partnership meeting is in Fairbanks. So thank you all again for being here. Appreciate this and just the wonderful energy and all the great work you all do. So thank you.